Embroidery involves connecting the brain with the hands in relaxing and repetitive stitches to create imagery on a fabric canvas. Focused concentration is necessary to create many of the stitches, freeing the mind from the presence of other worries and thoughts as attention is focused on the creation at hand. The small scale of the embroidery project would allow for participants to enjoy learning and practicing stitches at their own pace and to their own desire to add detail to their canvas. Materials for the project consist of a small piece of loosely woven muslin, small embroidery hoop or canning jar hoop, embroidery floss in various colors, and a needle. The canvas for this activity would come pre-stamped with a small image in several graphic floral shapes from which the participant could choose their favorite. The design of the stamped image also has a vague reference to the repetition and meditative mandala, yet they could simply be viewed as floral or graphic lines, allowing it to be interpreted by the participant to the significance of their choice. The stamped image would be a jumping-off point for the hand-embroidered stitches and can be used as a guide to either follow for placement or to play with positive and negative space within their work. Working with the colors of embroidery floss and a needle, the participant would choose how much or little to add to their canvas using the basic embroidery stitches. The needle in this application functions to create beautiful art, a departure from the traditional function of a needle in a hospital setting, allowing for participants to reflect on the tool in a different, more positive way. Various stitches can be taught, demonstrated, and assisted with through interactions with the artist. The opportunity to collaborate and consult with the artist or fellow participants could exist as the composition of each piece evolves. Collaboration could come in the form of choosing stitches, colors, or whether or not to add additional details. Of course, each participant could complete the project solely on their own if that's more comfortable as well. The embroidery project would be ideal for holding as a drop-in style format for either visitors, staff, or patients. Participants could come and go as they please, choose their own canvas hoop, select colors of embroidery floss, and an individual needle, an instructions sheet for basic stitches. Creating a personal kit would allow for few, if any, necessary shared materials, keeping infection control in mind. The artist would be available to assist, demonstrate, and facilitate in any and all areas of the project. Participants could be allowed to take the project and a small amount of supplies with them if they wish to complete the project at a later date. Completed embroidery hoops could also be added to a public group display for the enjoyment of everyone in the hospital.